It's really helpful to know that breathing techniques, exercise, really does help the spine. None of us really like to hear that, oh yeah, it's not just a pill, it's not just a cream. You actually have to breathe. You actually have to do little exercises to help strengthen your spine, and you have to have good posture. All the boring things, yeah, they're the ones that really do work. They really do work. I've tried plenty of pain medication. Trust me on that. However, this is what worked. The breathing, which relaxes the nervous system and sends the blood where you need it to go. Moving the spine to get the spinal fluid up to the brain and get it up and down, nourishing the nerves through your spine. Also, the exercises and the posture techniques to help the spine stay aligned. All of these things are the things that worked. And this video, I'm going to show you the techniques that I use. There's a lot of other ones. You can go see your physical therapist. That's where I learned these exercises. You can go look online for Qigong videos, and there's all kinds of breathing videos, all kinds of exercises that you can do. I would really encourage you to just keep your posture aligned, strengthen your spinal muscles and your core muscles, learn good breathing techniques, and use your diaphragm. All of these things are what really actually works. I'm going to give you lots of natural ways to relieve neck and back pain. I work at a desk all day long and type at a computer, and of course I've had many days of neck and back pain from sitting and having poor posture. I have learned all of these techniques, and I can tell you unequivocally they work magic, and I've gone weeks and months where I don't even have neck tension because I've done the following techniques. Now you can pick the techniques that work the best for you. The first one I'm going to go over is the foam roller. This is a simple thing that you can do at home to massage your back and give it a bunch of stimulation to the muscles, push out some of the tension, and give yourself a little bit of extra circulation, because the main reason that your back or your neck hurts is because of poor circulation of the spinal fluid, of the blood. And the foam roller is one way to increase circulation. Then massage. Again, your whole goal, number one goal, is to get oxygen and circulation to the muscles. So there we have a lot of techniques we use to do that. One is you can just borrow a friend and say, hey, please, my shoulders are tight, my pectoral muscles are tight, my back is tight, please. Maybe you guys can take turns with a coworker or someone that you trust to massage. These front muscles get really tight when we're sitting at the computer. We're reaching forward. These muscles get shortened and our neck is pulling forward. So you want to stretch out those pectoral muscles and massage them and get circulation going into those muscles. Then we want the back of the neck. We want the shoulders rubbed. This area that she's rubbing on me right now, this area is where the jaw gets very tight and it can pinch off the nerves and the arteries going to the head. Oh my goodness, can that create a migraine so quickly? Here's another angle where she's doing the shoulder blades, because again, the shoulder blades get really tight. And we're just doing circular motions because that will stimulate circulation and it really feels amazing. And then doing deep massage into the muscles of the shoulder to stimulate the circulation and really promote more blood flow to those muscles. The reason our muscles get tight is that blood flow gets cut off. The muscles tighten up and we actually lose circulation. And that makes the muscle tighten even more and cut off more circulation. So you can do trigger point massage where you push really hard on the spots that are most sore for a whole minute and then release it. It lets a little bit of blood flow in there, and that often will release that muscle from being so tight. Be sure and get this area below and behind the ear, because that's one of the areas that causes a lot of head pain. If you don't have anyone to rub your shoulders, then you can use a machine to do the same thing. I've got a couple different techniques here where we use this machine. This one is a strong back massage vibrator, and I've used this hundreds of times on myself. You can have someone else do it, or it's easy enough to just do it on yourself. There's so many ways that you can promote circulation to your spine: movement, massage, and oils. There's lots of options. Now here I'm using the massager on my jaw and the side of my neck, because sometimes I used to get really bad tension on the side of my neck and the jaw, and this promotes circulation. So you can use it all over wherever you get tight. Another machine you can use for massage is IQ technology, and it has 10 different settings that allow you to have different types of massage techniques through these little pads. So the little machine is what I'm holding in my hand, and then the pads go on the spot that you need to increase circulation. And what this is actually doing is it's giving me a little muscle stimulation, and my muscles tense up and then they drop again. So this is actually increasing circulation by tensing up my back muscles, and blood flows there. You got stimulation, oxygen. Sometimes when I've been really, really tense, I'll keep this on for hours. Now, my shoulders tensing up like that, that is caused by the machine. I'm not doing that. The machine is tensing up those muscles and then allowing them to relax, and that stimulates a lot of blood flow. Another option is neck exercises. Now, these exercises have helped me so much. My physical therapist gave them to me to do, and I started to have a stronger neck, more aligned neck right away. It's a pretty simple exercise that you can do over the edge of your bed or even on a floor. And so your neck is in a neutral position, and then you're going to tuck your chin under and lift your head back. So you're tucking your head under and lifting it back. Once you get into that position and you've done that 10 times, then you look side to side with your head in that same position. And you do this for 10 times on each side, looking in each direction 10 times, and also lifting your head and going back 10 times. This allows you to have a more aligned neck, because we are in a world where tech neck is so prevalent, where our neck is forward, and this allows your neck to be more lined up back. One more exercise that helps put our neck on top of our shoulders so that we don't have this forward neck is this exercise right here, where you stand probably 12 inches away from the wall, put a pillow behind your head, and then you lean your head back on the wall and keep your feet in the same position and hold your body plank, meaning you don't bend at the waist. Your body is straight, but your head, your chin is towards your chest, and your head is flat against the wall. And you hold this for 1 minute. And then when you come out of it, be very careful so that you're gentle on your neck as you come out of this exercise, and it also will help align your neck. Then we have stretches to relieve back tension. So this is amazing. When you have neck tension, your pectorals can often be the reason. So your pectoral muscles are from your shoulders into your chest. And these muscles, when they get tight from sitting and pulling forward like we're driving, or we're cooking, or sitting at a desk, doing something with our arms forward a lot, and then these get shortened and tight, and we have to stretch them out. And this actually helps the neck. I'm showing 3 exercises here. The first one stretches a part of the pectoral muscle at a 90-degree angle to the body. Then you move your arm up a little higher and you stretch a different area of the muscle, more going under the armpit. And you can even put your arm low and stretch a little tiny muscle at the shoulder, towards the front of the body. And do it on both sides. You'll be amazed if your neck gets tight. This is an exercise you're going to need in order to relieve yourself of neck tension. When I used to have a lot of neck tension, sometimes I needed a long stretch of the pectorals, and sometimes I didn't want to stand in the doorway for 15 minutes. So I would lie on the bed and do this stretch, because it's something I could do for a long period of time, lie comfortably, get a very long, deep stretch of the pectorals, and relieve that neck tension. I highly recommend it. It's easy to do, and you can lie comfortably while you get a nice deep stretch. You can move the arm behind you for even a deeper stretch if you're comfortable. This next stretch is highly effective for relieving tension at the base of the skull and helping with vestibular migraines and migraines that are causing vertigo or dizziness. And it stretches the fascia from the heel all the way up the back of the body to the base of the skull and relieves that tension, which can pinch nerves at the base of the skull and cause problems in the cerebellum and different parts of the brain. This stretch really does work. It's highly effective if you do it repeatedly on both sides several times. So you're going to grab up one wrist with your hands behind your back, and you're going to lift one of your feet, one of your legs, and pull your feet towards your body while you round your shoulders forward and bring your head down toward your knee as gently and carefully as you can. And then you're going to stretch the opposite direction. Go up, lift your chin up, pull your shoulders back and stretch up. And then you go back down, rounding the shoulders and lift the opposite leg. And pull the toes towards your body, bring your head down towards your knee, and then you go back up and stretch again. And continue doing this so you have done it 5 times with each leg, a total of 10 times minimum. You can certainly do more. Be gentle with your stretch so you don't hurt the body or overstretch, which is not good for the muscles. And what you're doing is you're allowing more circulation to go to the head by opening up the tension and releasing that tension at the base of the skull so you can get better circulation to the head. It doesn't cost you anything. Give it a try. It can be very, very valuable, especially if you do it ongoing and you can prevent vestibular migraines. Now, the next thing is movement. We definitely need lots of movement in order to get the spinal fluid moving up and down and having enough blood flow and nerve flow and muscle stimulation. Okay, so you're sitting at your desk all day, right? And you're just tired. You're stretching your, I feel tired. And what you want to do is sit at your desk and get in the flow. Like twist your back, twist your spine. Yeah, get some good stretches in there. Move your shoulders around. In your chair, move your hips. Yeah, do a little dance. Woohoo! Dance. See those moves? Oh, check out those moves. Oh yeah, got the feet going. All the coworkers are, wondering, she's pretty cool. Can I do that? You can just have fun with it. Get your coworkers to do it too. Or if you have to have a home office, you can do whatever you want. Just get your body moving. Stretch and you will feel so much better. Then stand up. Have some fun. Stretch. Move that body. Oh yeah. Oh yeah. Have a good time. Swing around. Do-si-do. Whatever you do. Yeah. Check out those moves. All right. Having a lot of fun. This is really important because as you move around, you are getting oxygen to all your muscles. You are making things happen. Absolutely. Have fun with it. Move. You're going to have air and oxygen going into your lungs. You're going to feel so much better. And then shake it out. Oh yeah, shake it out. Shake, 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 shake. This is another Qigong move. So in Qigong, you shake to get the stress away. You're boom, 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 shaking that stress off. Oh yeah, shake it off, shake it off. Just like if you have stress and they say, hey, shake it off, this is what they mean. Yeah. Get a little shake going, get a little movement going, move up and down the spine, and what a relief. That feels amazing. Pressure points is another way. Again, the goal is circulation. So all you're going to do is you're going to massage points across your face, and especially points that are tender. You can massage the points at your temple, massage points across your forehead. Of course, go down to your jaw, your cheekbones, your sinuses. It's very sexy. You should always do this with a camera showing your face. Not. And massage your jaw, and it just brings your awareness there, and it brings blood and circulation and flow of the lymph system, etc. Very effective. Be sure and rub the occipital area and the back of your head. And here's another view of rubbing some of the points on your skin. and on your face. And then again, this point on your hands will help with circulation. It's a great Chinese acupressure point that helps with pain. Now, when you do get neck tension and you've done the breathing and you've done the stretches and you've done the movements, now it's time for these products that help with muscle tension. And I use these following products. I use the Concula cream, the arnica cream, the magnesium oil, and the white flower oil. And I'll show you how I use them. I love the magnesium oil. It's one of my favorites. This gives your muscles direct magnesium right through the skin into the muscle, which is super helpful. See, when our muscles get tight and we get stressed, we actually dump out magnesium and calcium through the urine because they relax the body. And if you're in a stressful state, that you don't want the body to be relaxed. So your body will lose calcium and magnesium when you're in a stressful state. This puts it right where you want it, right in the muscle. Arnica cream has been shown for centuries to help with pain and soothing and relaxation. I love this particular product. It smells like ginger. It's arnica and ginger, and it rolls on and it can't stain your clothes like the magnesium oil can. And this is white flower. It's a Chinese product. It has eucalyptus, menthol, camphor, peppermint, and a couple other essential oils. And this is the one that relieves the most pain. It is a very strong pain reliever. You put it on a spot anywhere in your body, it will relieve pain. You don't want it in an open wound, and you don't want it in your eyes. And I didn't take a video of the cocoa cream, but the same thing. It massages into the skin and actually not only relieves pain, but also increases circulation. Posture is really, really critical. And we're going to talk a lot about posture. Amazingly enough, posture has made a significant difference for me. Now, if you have a standing desk, that's great because you're not always sitting and not always breathing shallow. But here's some standing desk positions you don't want to do. Don't crink your neck like that. Don't lean forward. Make sure that your arms are, in a 90-degree angle, and don't do these things I'm doing here. They're really terrible for the back and the neck. They're not giving you alignment and good flow. Make sure that you check your posture, check your breathing, make sure your jaw's relaxed, and do your work comfortably. Now, this counter height is not perfect for me. It's just demonstrating that we can stand up and do our work as well. When we're standing, you need to be very conscious of your posture because most of us kind of slouch our shoulders forward and we don't keep our head above our body. And that puts a lot of strain on the neck. A lot of times, see how I'm using these different positions? People will lean on their hips or push their back forward to not use muscles. And if you train yourself to stand up straight and use the correct muscles and engage your core, tilt your pelvis so that your buttocks and your legs are engaged and your jaw's relaxed. If you do that, your muscles won't be so tired when you're standing all the time. But if you don't train yourself to stand correctly, you're going to get more tired, and that's why you're going to lean, is to take some of the weight and put it on your bones. If your head is over your neck and shoulders, you're going to have far less back pain. And if you are lifting anything, you want to make sure your buttocks muscles and your leg muscles are engaged in that activity so that you don't injure your low back. Be sure and check that your head is over your shoulders by seeing if your ear lines up with your top of your shoulder and it's not forward of your shoulder. Breathing techniques are the number one. There's nothing I feel that has done better for me. Now, first, I'm going to show you the one where you're lying down. Deep, relaxed breathing is much easier to do when you're lying down because your diaphragm isn't being squished while you're sitting. And when you're standing, you're tending to use a lot of your core muscles. So the most relaxed place to do it is lying down. And what you're going to do is put your hands on your belly and just feel your belly rising and falling with each breath. Pay attention so that your breath is gradually filling the bottom area of your lungs. When you breathe with your diaphragm, what it's doing is it's bringing in air to the lower chambers of your lungs. And this is the message that tells your autonomic nervous system to go into a parasympathetic state, which is the calm state, the restful state, the rest and renew. This helps your nervous system to calm down and not burn up so much resources. Now you can do this technique sitting as well. So when you're sitting, just be more aware because you have a little bit less room and it's not quite as easy to do, but you're really going to have to concentrate on pushing that belly out and not using the shoulders. Your chest will fill up with air through the lower chambers first when you're using the diaphragm, and then if you take a big breath, it'll also fill up the upper area of the chest, depending on how deep a breath you take. But this is the breath you want, where you're going to communicate to the nervous system, yeah, everything is okay. We can go into a parasympathetic state, rest and renew, and calm down, make new cells, and not have the resources being directed away from the brain. You want to also be able to practice this standing up. Now try this. I want you to stand up and do the sitting down and standing up and practice this and get good at it so you're doing it all day long naturally, and you'll get your nervous system in a more calm state. So when you're standing up, you're going to be very conscious. It helps to put your hands on your belly, and you're going to feel your diaphragm expanding and allow your belly to fall out. Allow your belly to go forward. A lot of people are always, worried about having their belly out, but you need to expand the lower abdomen to increase the airflow to the lower lungs and calm down the nervous system. Then your nervous system won't be burning up those resources and having too many neurons firing and giving yourselves a migraine because you are breathing correctly. Another option, inversion therapy. Yeah, gravity, it works on our spine, and we have the disadvantage of gravity making our spine compress and go tighter and tighter. So there's all kinds of options. One is an inversion machine. You just step on this nice little machine. It's very easy. It's mechanical. There's no electricity involved here. And you lean back. You can set it so it's easier or harder to do. And it just automatically holds you upside down and takes all this weight and all this gravity off your spine. Helps you be taller, and it helps promote circulation and reduce compression. Okay, so if you have, your spine is getting too much compression, this will help. Now, be sure if you've had any injuries, check with your health professional, like your physical therapist or your doctor. Now, this next one, definitely check with your physical therapist or your doctor first. But this is my favorite. I do this for myself a lot. When my back would hurt, I would do this because it was like a deep, deep, deep massage that I could do for myself. Just gradually lay off the bed, gradually have the edge of my mattress just pushing into my spine and moving all that fluid around like a deep, deep tissue massage. And then right here, you can flip over like I did, or you can just turn over on the bed and slowly get off. Okay. The bottom line is, this is what I want you to know. Pain management is within your reach. Pain pills are not the best answer for chronic pain. With a little extra care, you can heal a lot of your back and neck issues. Sometimes it's caused by simple posture and simple habits. But the only thing you need to really remember here is self-care of the spine can keep you pain-free. Please remember that. Self-care of the spine can keep you pain-free. That's right. So take good care of your spine.